And we will continue with public testimony this morning on other bills. The chair lays out, as a matter of pending business, Senate Bill 1867. The floor is now open for public testimony. The chair calls Sarah Austin, William Morgan, and Paul Harris. Senator Campbell is now leaving to go vote in Business and Commerce. Thank you for your motion in writing. Thank you for attending today. Again, Sarah Austin, William Morgan, and Paul Harris. And I see that there's another card about to be dropped, and so if you could bring that one forward, please. Join us at the table. I'll call you in just a moment. We will start with from this side and go to the left. My left.
My name is Paul Harris. I'm here in support of myself, my patients, and the Texas Chiropractic Association in support of Senate Bill 1867. I'm a neurologist. I trained medical school and neurology at UT Southwestern in Dallas, in between which I spent 4 years in the United States Air Force on active duty as a general medical officer and ER physician. I'm here because I'm very concerned with the recent developments regarding the chiropractic practice. I am a TMA member, but I wholeheartedly disagree with their stance on this topic, and particularly with their lawsuit that necessitated this bill. There's been a lot of the sky is falling hysteria recently about the effects that this bill would have allowing chiropractors to suddenly practice neurology. That's not what this bill does. This bill simply allows chiropractors to continue to practice what they have for 40 years, unaffected by the TMA. I've worked with chiropractors for the 27 years I've been in private practice. I have found them more than capable and competent to see, treat, diagnose, and manage patients with neuromusculoskeletal disorders. And no one should confuse that for epilepsy, MS, Parkinson's disease, or dementia. That's not what they've ever done. That's not what they want to do now. But they help these patients with neuromusculoskeletal disease. I know because I've been there alongside of them, treating them for 27 years. And if we don't do something to clarify this law, the Practice Act, so that they're allowed to continue to do that, the people that are going to suffer the most are my patients, your constituents. I'm asking for your support. Please don't let that happen.
Thank you. I want to clarify. So you're an MD?
Yes.
And a chiropractor?
No, I'm not.
Just an MD?
I'm an MD.
And you're for this bill?
And I'm what?
And you're for this bill?
Yes, I am.
Thank you. If you would state your name for the record and who you're with.
Chair Colcourse, I'm Sarah Austin, Dr. Sarah Austin. I'm a neurologist here in Austin, and I'm representing the 1,000 members of the Texas Neurologic Society and the 53,000 members of the Texas Medical Association. I'm testifying in opposition to this bill. The current statutory definition of chiropractic represents its focus on the musculoskeletal system. Senate Bill 1867 would add neuro...
If you could speak a little louder,
Yeah.
lean forward and pull that microphone towards you.
SB 1867 would add neuro to its definition. We find this an unwarranted expansion. It would be extremely confusing to the public, and the addition of the nervous system to the scope of chiropractic is unsupported by their education and training. Simply alleging that the basis of this proposal is because it is impossible to treat conditions related to the musculoskeletal system without a neurologic connection is misleading, and it's oversimplified. As you know, healthcare providers will often be experts in a particular body system. For example, ophthalmologists are specialists for the eye. Certainly there are nerves, muscles, and blood vessels in the eye that are necessary for function, but the ophthalmologist does not call herself a neuro-cardio-musculo-ophthalmologist. The public understands that the system named in our title and in our license is what we are expert in. Adding the term neuro to the title of chiropractic would expand the scope of the chiropractic to the entire nervous system. This would include the brain and the spinal cord, the peripheral nervous system, the vestibular system, and the autonomic nervous system. Specialists in nervous system care for patients with diseases such as dementia, epilepsy, headache, concussion, multiple sclerosis, brain tumors, Parkinson's, and stroke. Physicians who specialize in neurology have spent 4 years in college, 4 years in medical school, and at least 4 years of intensive residency training, typically 12 years total after high school. In addition, we take a minimum of 48 hours of CME, continuing medical education, each year. Contrary to a number of allegations, not passing this bill will have absolutely no effect on the current practice of chiropractic, but passing this bill would be a huge expansion of chiropractic scope of practice, without the practitioners having anywhere near the necessary training and education to treat
Let me
these
ask you a couple of
diseases.
questions on that. And, you know, this has obviously been heavily litigated, and I think that eventually the legislature is going to have to give some guidance to this. So is there a way to craft this that allows chiropractors to manipulate the spine or the skeleton and not become neurologists?
Well, in our mind, they are allowed to manipulate the spine without saying neuro, just like orthopedic surgeons specialize in the musculoskeletal system. They obviously manipulate nerves when they're there, but they don't typically treat for vertigo, which is one of the things that the chiropractors would like to do. And that, in my opinion, vertigo is only in the brain. It's not part of the spine. I don't understand why they would think that musculoskeletal would apply to vertigo, but they do. Orthopedic surgeons don't treat vertigo, but the chiropractors would like to. So I think the way it's written now is perfectly understandable to me what their scope of practice is.
Senator Buckingham,
Yeah, thank you, Madam Chair. Dr. Austin, so we've heard a lot about the lawsuits. I don't really
Senator,
exactly what the fight was in the lawsuit. So what is the lawsuits?
As I understand it, the lawsuit is about the ability for chiropractors to do testing for the vestibular system for patients with vertigo. So the vestibular system is the inner ear and then the brain that causes vertigo, and they would like to be able to do that testing. So it's not related to the spine, so that system is in your head.
gosh, we've been studying this a little bit. It's not my bill, trying to figure this out, because I'm about to ask someone either with the AG's office or with the chiropractic board who's paying for all this litigation. Does TMA pay for all of its litigation against this?
Yes.
Gosh, we just need to settle this. And I mean, in a way that lets a chiropractor manipulate the spine, and I mean, Senator Buckingham, I'm going to yield to you on a lot of this, but can we not just get this done so that the lawyers quit getting rich? Or maybe the lawyers like this. I don't know. I certainly employ a lot of lawyers at different times, but we need to figure this out.
Well, and if I may, Madam Chair,
Senator
sometimes
Campbell.
boards propagate rules that expand their scope independent of legislative intent. I'm not saying that's the case here, but that's also something to kind of watch too, as our various state agencies propagate rules that may or may not be within the wishes of the legislature, direction of the legislature. I think that might be some of the issues too.
Question the witness.
Senator Salger, and then Senator Miles.
Did he push his light first? Dr. Austin, since chiropractors do, as you say, manipulate the spine and extremities, implicit in that, isn't it the effect on or affect of the nervous or neuromuscular system?
Can you ask that again, please?
Well, since we know that chiropractors do manipulate the spine and joints, implicit in that manipulation is some effect on the neuromuscular or nervous system, is it not?
That's correct, because the nerves travel through the spine.
So if one takes exception to use of chiropractors of musculoskeletal system and the nervous system, aren't we really splitting hairs?
I don't know. I just know that when you say neuro, or if you call yourself a neurological chiropractor,
But it is a
that implies
neurological...
different to the public.
But it is a neurological system. You have to use the word neuro in some of those contexts, do you not?
You know, in medical terms, in physician terms, we don't say, you know, the orthopedic guys deal with blood vessels sometimes because the blood vessels run through the bones, but we don't call them vascular orthopedic surgeons, you know.
Nobody is.
So, yeah, all the systems are interrelated, completely interrelated, but we
So
don't
are we
name them
splitting hairs
separately.
by their use of the word neuro or neurological?
I think so. I just think it's very confusing to add neuro to it. It sounds to me like, and it sounds to the public like you're expanding the scope.
Is anything, expanding the scope is not grammatical. It has to do with certain services or processes or things like that. The services provided by the chiropractor. The fact that they're simply using words here has nothing to do with scope of practice. That's scope of speech.
So the way I see it is if you say neuromusculoskeletal, neuro to me implies that you do take care of things of the brain and the spinal cord, and so vestibular testing would be covered.
But nobody said anything about vestibular. That's a different issue besides neuromuscular.
That's, to me as a physician, neuromuscular means something different than musculoskeletal. So neuromuscular is me, I'm a neurologist. Musculoskeletal for physicians would be an orthopedic surgeon.
Okay. My point remains, I still think we're splitting hairs here and not getting into questions of scope of practice, but scope of speech. And that's, I don't see the point. Thank you, Madam Chair.
Sarah Miles, did you have a question? Sarah Miles, did you have a question? Just a quick follow-up. What if we were able to say in the legislation, you can't call yourself a neurologist, neurological, blah, 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 chiropractor? I mean, again, what I am fearful of is if we don't settle this again, the litigation costs continue to go on and on and on and on and on. And I think, Senator Buckingham, we're going to find out some of those costs. I do want to call the expert witness, which is Christopher Burnett from the Texas Board of Chiropractic Examiners, if you would join us at the far end of this table. But that, again, you know, personally, I use medical doctors, and but I also occasionally, sitting in these chairs all day, I have my body manipulated to try to get it back in line. And I don't want to put all chiropractors out of business if, and I mean, like they stated, and sometimes when your insurance says this is what you're treating or this is allowable for a chiropractor, that gets real confusing. And certainly if I'm going in for, say, my sciatic nerve or something like that, I don't have a sciatic nerve problem, but it just comes to mind after sitting in these chairs for the last 5 months, that, I mean, are we going to put the chiropractors out of business? And I see value in it.
There is no litigation saying that the chiropractors can't take care of spinal nerve roots. I mean, that's what they do. You know, that's part of their deal. That's part of the musculoskeletal spinal neuroaxis. But when you expand it to neuro, it means to me that it's brain, spinal cord, you know, all that kind of stuff too, so.
Well, maybe we can get to a point where we get very specific about what it means, and then everybody can stop suing each other. We have expert witness here with Paul Harris. Sorry.
This is Dr. Harris.
I'm sorry. Christopher Burnett. Would you state your name for the record?
Yes, Madam Chair, my name is Christopher Burnett. I'm the General Counsel for the Texas Board of Chiropractic Examiners, and I'm here to speak on the bill.
And so litigation cost, who pays both sides of this litigation cost?
Well, Madam Chair, the litigation cost for our board is borne by the state. Don't have the exact figures at hand right now. I believe for last year on this lawsuit, The amount expended both by us and the Attorney General's office and the Solicitor General's office was about $40,000.
Okay, and how long has this lawsuit been going on?
Several years now.
And do we hire outside counsel, or do we just use inside counsel?
This has been, the attorneys for the board have come from the Attorney General's office, and now the Solicitor General's office. So there have been some experts for testimony purposes that I believe the AG's office has used, but no outside counsel, no.
So if we were to actually put a cost to all the hours spent by our state, our civil servants, it probably would be a little bit larger. Obviously, it's taking up some of our bandwidth.
Yes, ma'am.
I would also ask in I think we're at the Fifth Court of Appeals, but they have ruled against the chiropractors because our statute is not specific. Is that correct?
Yes, ma'am, and may I say, it's not at the Fifth Circuit. This lawsuit is pending. There has been a petition filed by us and the Texas Chiropractors Association with the Texas Supreme Court for a petition for discretionary review that's pending. The case, we're appealing the decision of the Third Court of Appeals.
Great. Any other questions? Senator Buckingham.
Thank you, Madam Chair. Can you just remind us, what is that lawsuit about?
There's basically two issues in this lawsuit. It's a rules challenge at its core. First, the Texas Board of Chiropractic Examiners adopted two rules several years ago. The first rule, as has been mentioned, talked about this vestibular testing, VAUNT, and I can't remember the whole word makes up the acronym. It's a certain type of testing. And the TMA challenged the board's authority to do that particular test, have a rule that permitted that particular type of testing. The other one was on the question about subluxation complex, which is the manipulation of the spine, in which the board in a rule said that included the neuromusculoskeletal condition. It was a condition. And so TMA's suit is over basically that neuro component. The board's position throughout the litigation has been that, as some of you all have mentioned, that neuro is kind of implicit within the musculoskeletal system, such as the example of sciatica. You're treating pain, which is you notice through the pain of your nerves. The board's legal position is also that these rules did not increase the scope of practice. That is our argument going forward with the Supreme Court, and that the effect of Senator Hinojos' bill is merely to clarify what the status quo is. It would not increase the scope of practice.
So Mr. Burnett,
Yes, ma'am.
how do you respond to, we hear from some folks, we just want to keep doing what we've been doing, it doesn't involve the central nervous system and vestibular testing and all that, but yet the rule in question was about vestibular testing.
Well, I believe, and this predates my time at the board, but the rule was intended to allow chiropractors to do the testing. Chiropractors do all sorts of testing, and if there is a condition that they discover through that testing that would be outside their scope of practice, that would require referral to another medical practitioner, such as a physician, they can do that. Testing, diagnosis does not mean necessarily that they have the ability to treat. And so the vestibular testing was like, oh, okay, this is something that is, there's a condition here that is outside our scope to treat, we would refer.
And is there something in this bill that would, did I see somewhere that it would make insurance companies cover these tests?
That I can't speak to. We don't have any jurisdiction over insurance.
Okay, thank you.
What if the bill said that you could not expand scope? I mean, like, what if you just narrowed it down to give you the ability to practice if you're practicing today, but you could not And it was very directive to the Board of Chiropractic.
Well, I think the issue, Madam Chairman, is that the board's position is that the current statute, by using the term subluxation complex, which by common understanding includes the nerve component, that the chiropractor's scope of practice is what it is. That the bill that Senator Hino's bill would not increase that scope of practice, would not expand it. And so it just simply puts into words what is understood through subluxation complex.
If you say it is what it is, how do you include vestibular testing in there, and what is the relationship between that and the neuromuscular system with the subluxation complex?
Well, Senator, thank you. I'm not a chiropractor. I'm not a doctor. My understanding is that there are some conditions that can be treated, and I have to defer to our doctor here, that can be treated by a chiropractor as a result of some things that can come out of this vestibular testing. For the most part, however, it's going to be ruling out things that they could practice, or that they could treat, and it would require a referral.
I think the devil's in the detail. And, making sure that chiropractors can practice and keeping them within the scope. I think that the state of Texas has enjoyed for many years, and not getting confusion, but not shutting them down. That's just a personal opinion and a side note.
And Madam Chairman, if I could, the board's position in conjunction with the lawsuit is that if TMA were successful, or the Supreme Court does not hear this appeal, that it does call into question the scope of practice for chiropractors currently, and that we probably will end up having to revisit this issue later on.
The most common vestibular tests, what do they cost?
I have no idea, Senator.
Dr. Austin?
I don't know either.
Okay. We might have a witness that can answer that question. So with that, we'll move to our next witness, and that would be William Morgan.
Hello, my name is Dr. William Morgan. I'm a chiropractor, and I'm president of Parkland University in Dallas, Texas. I'm here to testify in support of Senate Bill 1867 on behalf of myself and Parkland University. Senate Bill 1867 clarifies that there's no neurological component to chiropractic. And as a chiropractor who's practiced for 33 years, I've been in 5 hospitals, including Bethesda Naval Hospital, Walter Reed. I've been the chiropractor to the White House. I've been the chiropractor to Congress. I've worked in neuromusculoskeletal service lines at Walter Reed and Bethesda. I've worked in a physical medicine department where it essentially is they treat complex neurological conditions as a member of the team. And at Parker and in chiropractic, we seek the EPIC, which stands for evidence-based, patient-centered, integrated, collaborative. So we want to work with a neurologist. If I swing a reflex hammer, I'm not testing the muscles, I'm testing the integrity of the nervous system. Anyway, I just like to speak to the value that chiropractic care provides to our military members and veterans. We provide care in the DoD. Neurology is included in our scope of practice there. There's not been a problem with chiropractors exceeding their scope of practice in the Department of Defense or the VA or the other 49 states that allow this. And 39 of those states mention neurology in the bill. Further, in order for our college to maintain accreditation and to stay in Texas, we have to teach neurology and have access to those patients that they can practice the diagnostic skills of understanding what neurological conditions and make the appropriate referrals to neurologists. So for us to stay here in the state, we really need to have this included in our bill. SB 1867 does not expand scope, as you've heard, and basically I'd like you to pass this bill to maintain the access of Texans to chiropractic care
I think that Senator Sullivan, could you answer Senator Sullivan's question, which was, what was it? It was the cost of Senator
For the
Sullivan?
want test, I can't say, if you want an order of magnitude, I would imagine it would be between $100 and $500. I can't, that's my guess is that order, it's not going to be an extremely expensive test, but it's
How
also,
often do you do vestibular testing on your patients?
I rarely do, I don't, I usually defer to a physical therapist who's also not a neurologist. When I was at the hospital, but at Walter Reed,
But
they
those are
were
mostly issues of balance.
Yes, exactly.
But in terms of vestibular pathology, how often do you test? What sort of tests do you do that? Or how often do you order those tests?
You're talking a specific test? Ironically, at Walter Reed, our neurologists wouldn't even do those tests. They would refer them to a mid-level provider to do those tests. So it's kind of funny that comes up here. When this is needed, if somebody comes in with, we'll do a gait analysis, if they have ataxia or some other type of gait disorder, we'll test it further with our tests that are part of a normal neuroexamination that any provider would need to know, and then we could make the appropriate referral to a specialist.
But primarily it's a balance test.
It's a balance test. Well, it's more than that, for the want is more than that. There's certain things you do, there's eye motion therapy evaluations you can do, there's motion, there's chairs that move.
Yeah, you put like your cold in the ear and watch how your eyes move, and then you can spin a patient and watch the response.
It's not a dangerous procedure. What's that, sir?
And you do that kind of testing?
I don't personally, there are chiropractors who do it around the country. It's not a high-risk procedure, it's very
What does that
remote.
tell a chiropractor?
Sorry?
What does that tell a chiropractor?
Well, basically, what type of vestibular disorder do they have? Is it an inner ear problem? Is it visual? Is it cerebral?
Brain
Is it a brain problem? Exactly. If it's a brain problem, guess what? Refer to a neurologist.
Senator, if I could, I'll just put it clear, the board's current rule on this testing, not every chiropractor is permitted to do it. The rule requires that you have certain level of training before you're.
Thank you, Mr. Chair.
And
Senator Buckingham?
Thank you, Madam Chair. So if you have to have a different level of training, do they go by a different title?
No, ma'am.
They just go, and that training is what?
I believe you have to have a diplomate and I can't remember the exact title for it.
Like a weekend course, something pretty easy.
But there's some additional training you have to have.
Thank you. And then our last witness is Sheila Hemphill.
I'm Sheila Hemphill with Texas Right to Know, and I am for this bill on behalf of myself and as the testimony of the public. I find it ridiculous that we're sitting here talking about whether or not nerves are affected by spinal manipulation. What's in the spine? That would be nerves. I think this is a classic example of the TMA doing their job of turf protection. We as the public want our problem fixed. So if we go to the chiropractor and he's able to do the adjustment to fix our vertigo, which I personally have had vertigo, I've had it fixed by chiropractic adjustment. I've also had it fixed when tension is in the neck and it builds up the lymphatic system. And I don't have a lymphatic massage, and I don't have vertigo. I don't care where the standard care says that that's supposed to originate. All I want is to be fixed. So I urge you to please put in a law about nerves is affected by chiropractors, because we are dissecting our body to our detriment. Where if you're not a certain specialist with certain board certification, then you're in violation. And I know this for a fact, as it has come up in a court case. I don't have it, but I can get it to you, in a situation where a podiatrist, did this patient come in with hip problems? Yes. Did you adjust the arch? Yes. Is his hip problem gone? Yes. You are outside of scope of practice because you adjusted something outside your scope. We must fix this. Stick the word in. We, the public, are not that confused by the word neuro. So thank you. Oh, wait, I've got 20 minutes. I just really hope this is evident. This language needs to get in here and stop this nonsense of battering back and forth between the TMA, the TMB, the Texas Chiropractic Board. We are in a healthcare crisis, and we need to start equating everyone. Thank you.
I'm glad you were able to use up all your suggestions. Having said that, I'm going to ask one more question of this panel. I don't know who to answer this. In Ms. Hemphill's example of going in and saying, I've had some bouts with vertigo, I'm dealing with this, I'd like to have my spine adjusted, I'd like to have the massage therapy or whatever. Is that against the law for a chiropractor to do?
It's the testing that's supposed to be done by doctors if they're trying to hold on to their turf.
I don't know, doctor?
Do you
Is it against the law for someone to go in and say, I've had some bouts with vertigo, and I'm trying everything, and maybe I just want to get a line, I want to get kind of a wholeness approach, and there's maybe a massage or, pulling on the ear or whatever.
My thought is that vertigo is outside of the scope of chiropractic. Vertigo to me as a neurologist is scary because it can mean a brainstem stroke or it can just be a minor problem in the inner ear. But I find, I've been doing this 34 years, I find it hard to differentiate a vertigo patient. Who's having a stroke and who just has an inner ear problem. So in my mind, vertigo is way outside the scope of chiropractic.
But I mean, is it wrong for a patient to go in and say, I'm going to try everything, can you manipulate my spine, know that I don't have a brain tumor or whatever? Is that against the law for a chiropractor to do?
No, it's not, and I would disagree that vertigo is outside of our scope, but, or I should say our expertise. We definitely try to teach, our education is designed that our scope of knowledge exceeds our scope of practice. So we want to have plenty of knowledge on either side of it, but it does not, it's not against the law now.
Okay.
But depends how the lawsuit goes and how the board interprets it, it could be.
All right, thank you. We appreciate the witnesses. Members, we do have, is there anyone else wishing to testify regarding Senate Bill 1867? If not, that concludes public testimony on this bill, and public testimony is closed. Let it be shown that there were 9 witnesses registered for the bill but not wishing to testify, and 5 witnesses registered against the bill but not wishing to testify. We will leave this bill pending before the committee.